Hello everyone, my name is Jonathan Chapman. I'm a transportation planner with the City of Calgary. I first got involved with the Renew team after the pedestrian strategy at the City of Calgary got approved in 2016. I reached out to the university to meet with researchers who were doing work with a variety of topics related to walking, and I met Suzanne and the team and started talking about newcomer Calgarians and the barriers they might face to walking in their communities. I was interested if there were cultural factors at play there, and so we partnered to do research using ethnographic methods to find out more about newcomers and their experiences in the city. One of the outcomes of that is the Empathic Cultural Maps tool, which you can see here behind me, which allows us to tell the individual stories of some of the participants in our study and tie those to big data and be able to see mapping information or statistical trends over time and how those connect to individual stories. So as we were going through that research, some themes started to arise out of the work we were doing with our newcomer participants, hearing some of their concerns and issues that the city wasn't currently able to address. And so the research team started thinking about how we could develop some interventions that would approach these problems in novel ways. The exercise that I'm going to walk you through today is a way of developing partnerships that can bring different agencies together to treat a problem in a way that none of those agencies alone would be able to achieve. Okay, so for the exercise today, I'm going to introduce you to the Nucan family, and we'll talk about one of their problems and how different agencies might come together to solve that problem. The Nucan family is a husband and wife with 5 kids, 13, 11, 8, 6, and 2. That's not uncommon for the newcomers we're working with in Calgary. They're living in a large Canadian city, whichever one you like, you can imagine. They've been there for about 6 months. They had no previous experience with English, and they don't have a car. And the husband of the family is working nights in an industrial area of the city. And the problem that we're going to try to address, just to pick one of the many problems that the Nucan family might have to face, is that they have a limited access to healthy food, which is leading to poor health, stress, uncertain employment, and a bunch of the other negative outcomes that we've been hearing about through our research. So in order to develop a potential intervention to help the Nucan family and other families like them in the same part of the city, we're going to take on the roles of people from a variety of different agencies. I'm going to introduce you quickly to 5. So we have Calgary Transit. That's the agency in Calgary that delivers bus and LRT service. We've got the Peter Lougheed Hospital. It's actually quite close to where the Nucan family lives, and that's where they might get emergency medical care, and also there's a lot of clinics in that area, so any other medical needs that they have might be met in that area. Here's where Mr. Nucan's employer is. It's not super far away, but definitely way beyond a walking distance. And then also the family attends English language classes at a local immigrant serving agency. And then quite far across the city, Calgary Food Bank is a resource where, whether they're newcomers or not, Calgarians can access healthy food at no cost or very low cost to them. So what I need you to do today is to stand up out of your chairs if you are sitting in chairs, and get into groups of 3 to 5 people. And what I want you to do is for each of you to pick one of these agencies at random. Don't try to have all 5, maybe just pick 3 of them that your group is going to work on. And what you'll see when you go through the exercise is that different groupings of 3 agencies will come up with very different solutions to this problem. Okay, now that you have assembled your group and figured out which agencies you're role-playing in this particular exercise, the first step of the exercise is to brainstorm all of the assets that these different agencies have combined. Don't worry about who's going to pay for what. Just make a long list of all the different things that these agencies have access to. You think of Calgary Transit, they have buses, they also have drivers, they have a call-in center, they have online information, they have a low-income transit program that connects with people in interesting ways. So all of those things might be assets that they could turn, and lots of others. I'm hoping you'll think of some more while you're doing this. But as I said, don't worry about who's paying for it, just brainstorm that list, and then once you have that, we'll move on to the next step. Okay, now that you've got that list of the many assets that these different agencies have, I want you to brainstorm a potential intervention that could address the newcomer family's need. Remember that we're trying to help them get access to healthy food and fit into what's probably quite a hectic schedule of getting to work, getting to their language classes, and they don't have access to a car, so they may spend long periods of time traveling around. So when you're putting those together, don't worry about whose asset is whose. Just pick from the pile, put together some things that you think would be an interesting solution to that problem. And then think about making what I call an elevator pitch for that idea. So we're talking about 30 seconds to a minute description of what that idea is that you could give to a granting body or somebody who's a policy person, so that they could understand what exactly it is the idea is and start to get excited about it before they worry about exactly whose resources are whose. Okay, so today you've done an exercise, what we call asset-based partnerships. The purpose of this exercise is to break down some of the assumptions that we tend to make about what is and isn't in the mandate of the agency that we belong to, and finding new ways for agencies to partner together to solve problems in interesting ways. Maybe one of the pitches you guys came up with today, or some combination of a couple, might be that idea that sparks a funder or one of those agencies to take the lead and develop a pilot project. It's really important to take research into that pilot project phase, because what that does is it lets you test out that idea on a small scale, see what works and doesn't work in a very specific context, a specific city, with specific partners, with a specific newcomer population, because the results could be different along the way. But to start somewhere, what that does is it lets you prove the value of that idea and start to understand how you can make that better and roll it out into a broader program to address a specific need across the whole city or even country. Thank you.